Right, so the shoulder. I just wanted to put together a short video on the muscles of the shoulder, in particularly concentrating on the rotator cuff. Rotator cuff is a common site where people pick up injuries, and lots of people have heard of it, so I just thought I'd show you a little bit of a deeper look using this app. So if we look in at the left shoulder here, we've got this big muscle over the top. This is called the deltoid. So I'll just take that layer off, which gives us a better look in at the deeper muscles here. So if we, this is the front, looking at the shoulder front on, this is at the back. So on the inside of the shoulder blade, coming from the subscapular fossa, which is just a depression in the shoulder blade, we've got the subscapularis muscle, which is one of the four main rotator cuff muscles. The subscapularis is responsible for internal rotation primarily. So if we just look in at, it gives us a good look here. Yeah, so if you've got your elbow bent to 90 degrees next to you, when that muscle contracts, it's going to help bring the arm or the palm in towards your stomach. It comes from that fossa and attaches into the lesser tubercle of the humerus, which is a bony prominence on the inside of this upper arm bone here. And then let's have a flip round the back. So this big muscle here, well, it's small in comparison to other muscles, but big muscle, flat muscle, which sits on the back of the shoulder blade, so the infraspinous fossa, and attaches into that back lip or back portion of the greater tuberosity on the humerus bone. So this muscle is responsible for externally rotating your arm. So if you put your elbow 90 degrees next to you, you'll take the hand away from your midline. So if we just have a little look in here, so we go to the media, the infraspinatus, so it just gives us posterior, which is the back view, lateral view, which is the side, and then we should be able to see the actual motion of it. So there it's got the arm straight out, so it's horizontally abducted, and then the external rotation is pulling it back there. And then lateral rotation, which is primarily what it's known for, is taking the arm out to the side. So the infraspinatus there. We'll move on. So this muscle, which kind of sneaks up the side border of the scapula here, is called the Teres Minor. So if we just put a pin in there, you can see it here. So Teres Minor again is an external rotator. Comes from the upper 2/3 of that lateral border of the scapula and attaches into the greater tubercle of the humerus again. So if we just have a quick look, lateral rotation of the arm. This is quite a small muscle, but it works in conjunction with the rest of them to perform its actions. And then we've got on top, which I think we should be able to see better from this view here, is the supraspinatus. So the supraspinatus is probably one of the most common muscles to get injured, just due to where the actual tendon comes under the acromion, attaches onto the top of that humerus bone there, and there's quite a small distance between that tendon and the acromion here. And often when your arm gets to 80-90 degrees abduction, which is lifting the arm up, you can often get impingement or friction of this tendon, which can cause little micro tears in there. So you can get acute tears, or you can get age-related degeneration. Seeing quite a lot of people at the moment between 65 and 75 who are coming in with a lot of shoulder pain, and it's just crept on. There's been no traumatic incident, and they're looking at a partial or full thickness tear of that supraspinatus tendon. So if we click on the pin, so this muscle is responsible for abduction, but also key stabilizing muscle in holding the head of the humerus depressed in its cavity. So let's have a look. So abduction is basically arm by the side, lifted up. There's reports to say that it's kind of really important in the first 20-30 degrees of abduction. And actually the supraspinatus tends to, at the top of the movement, actually becomes an adductor. Some reports showed that, so its function is kind of dual. Supraspinatus, let's have a little look in there. Okay, so overall, the four muscles, we've got subscapularis, which is the one on the inside. We've got infraspinatus on the back of the shoulder blade. We've got teres minor, which is the small one, which sneaks up the side. And then we've got supraspinatus that sits on the top. So you'll see here that the tendons all look to be quite singular. However, they're actually attached via a sheath. So you can't really isolate a certain rotator cuff movement. They all kind of pitch in together to keep that head of the humerus stabilized. So if you think about the analogy of a golf ball on a tee, there's a lot of movement there, but there's not much stability. So if your rotator cuff is weak, you're going to have too much play in the joint, which then exposes tendons or other structures to then become the source of pain. So hopefully that's been useful for you. I'll go through a few more videos highlighting the muscles that then go over the top of that rotator cuff.